All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show for Tuesday, October 2nd, 2018. Wow, it's flying along. We're right already, second day of October. Tonight we're going to be talking a lot about the heart, which we do a lot of on the show, but we very rarely get a cardiac electrophysiologist or electrician of the heart, and there's many reasons why these are important providers in the healthcare landscape, and one of them is atrial fibrillation, which we've talked a bit about on the show, but we haven't talked from a cardiac electrophysiology standpoint, and they seem to, this medical specialty seems to have a great treatment options for atrial fib, or AFib as you hear it in the news. So without further ado, I'm going to welcome Dr. Ahmed Osman to the program. Dr. Osman, thanks for taking the time this evening. How are you doing?
Very well. Thank you for inviting me.
And thanks for coming. I always say on this Adventure of Health because we really learn so much. So I kind of said a little bit about electrophysiology. I said electrician of the heart because I've heard that term before, read about it. But please explain the field of a cardiac electrophysiology, because I don't think a lot of people know. I think a lot of people know it has to do with cardiology, but what is it?
That's true. So I also used electrician of the heart analogy just to make it a little bit closer to everybody. But it really does involve taking care of rhythm problems of the heart. As you know, the heartbeat is an electrical phenomenon. So I am an electrician of the heart, and we deal with all the disturbances of the heart rhythm. The slow heart rates, the fast heart rates, the abnormal heart rates, and the life-threatening heart rates. And there's a lot of different abnormalities that we can now address in a very effective way to relieve symptoms and to prevent major problems.
Now, these slow and fast beats, are these also known as heart arrhythmias? Because we've heard that term before, right?
That's exactly right. So that's the actual technical term for a disturbance of the heart rhythm. So an arrhythmia can be a slow arrhythmia or can be an abnormal rapid rhythm that can affect a lot of the patients. And it's a very, very common rhythm problem. It's a very common cardiac problem. Just to give you a perspective, 1 in 4 of us will have atrial fibrillation in their lifetime. So it's an extremely common rhythm problem nowadays. We are recognizing it a lot more in our patients because we have better ways of detecting it. And I'm sure you've heard about the Apple Watch, which will be able to basically diagnose atrial fibrillation, which is really a welcome addition to our common instruments and tools. But also we are aging, and the people are living longer lives and surviving a lot of the heart problems that may eventually lead to atrial fibrillation.
I'm glad you mentioned Apple Watch. I just read an article on that. I was wondering what Apple was up to. They've been very quiet. No, I'm just kidding. They're never quiet. But no, they're doing some great things. I also saw I don't know if you have heard this, that it also is going to help with falls. If because the fall risk is huge, and you already mentioned the baby boomer population. My parents, they're aging. They're getting up there a little bit.
Absolutely, and every little bit of technology that's useful to us in preventing problems, detecting problems, and like you said, if somebody passes out and is on the ground too long, it may call 911 automatically, which is really amazing. So it's all very welcome new technology to our lives.
It is great news, and I'm glad you did mention that. We're going to be talking a lot of technology on this program with Dr. Ahmed Osman. He is founder at Florida Heart Rhythm Specialists, and we're going to give out some of that info of his practice. Dr. Osman, before I forget, what hospitals are you on staff around here in the Fort Lauderdale area?
So I've been blessed with 3 other partners, and we cover all hospitals in Broward County. But some of us are in some more than others, and I spend most of my time at Broward General and Florida Medical Center.
Okay, Florida Medical Center right in Fort Lauderdale, and we've had a lot of doctors on the program. Something that I already learned, I told you when I sit in this chair, I learned so much from the doctors. I'm a lucky guy to have this health information right at my fingertips. And one of the things you said, I always thought of heart arrhythmias as fast beating, but you said also slow.
So a very large proportion of what we see on a daily basis has to do with the abnormal rhythm conduction. So as we age, we sometimes find ourselves with problems either in the generation of the heartbeat or in the conduction of the heartbeat down the special wiring system of the heart. And that's what we typically treat with pacemakers. So patients who do start having slow heart rates, slow pulse, that can cause dizziness, lightheadedness, weakness, or sometimes fainting, can be very nicely treated and by pacemaker insertion, which is part of this arrhythmia spectrum that we just mentioned. The other arrhythmias that are very, very common, like the atrial fibrillation, which I think we'll need to talk a little bit more about, are more irregular, more rapid, more bothersome in the sense that patients typically present with palpitations, feeling their heart fluttering, shortness of breath, sometimes chest discomfort or chest pain or chest pressure, and sometimes it can cause fainting as well, or dizziness or lightheadedness. So there is a very wide spectrum of symptoms. There are patients, however, that present without major symptoms, without any symptoms, and those sometimes we worry about actually just as much. And I'll tell you why, especially with atrial fibrillation. It really is important to detect and diagnose the disease.
Is that something that maybe a primary care physician could hear? Is that what they're listening for when they listen to our chest at a wellness visit?
Yes, they do. When they listen to the heartbeat and the heart sounds, they will very easily detect that it is an irregular rhythm, and that's the way we describe it very commonly in medical schools. An irregular rhythm that's sometimes a little bit on the faster side, and that can be very easily diagnosed by listening to the patient and then doing an EKG or electrocardiogram, which will show it very easily. It's a very easy diagnosis, really. Important that we not miss that in patients presenting with a lot of different symptoms, because it is one of the leading causes of stroke. And it's a very preventable cause of stroke, and diagnosing it really makes the rest of the workup a much safer, situation for the patient.
We've always thought of stroke as the brain, but now here we learned tonight that it has to do with the heart as well.
It is the brain always, but it can be from clots that can form in the setting of atrial fibrillation, and those clots can break off from the upper chambers of the heart and then travel to the brain and cause what we call an embolic stroke. So 1 in 5 to 1 in 4 of these strokes, of all strokes, are related to atrial fibrillation, and it's a very highly preventable cause of strokes. So important to diagnose the problem for sure.
We're here with Dr. Ahmed Osman. He is a cardiac electrophysiologist, Florida Heart Rhythm Specialist. You were telling me before, main office is 1841 Northeast 45th Street in Fort Lauderdale, but you have offices in Plantation, Margate, Lauderdale Lakes, right on the campus of Florida Medical Center where you're on staff at as well.
Exactly.
So that's important. Their number is 954-678-9531, and we'll give that out a few more times. It's flahrs.com. That's flahrs.com is where you can find out the information of Dr. Osman and his staff. You said 4 cardiac electrophysiologists.
Yes, we've been very busy, and we've been very proud of the services that we provide to Broward County, and we have a lot of very, very nice technologies that I'd like to actually share with you a little bit today as well.
Well, we're glad to have you, and yeah, well, let's talk about one of those. For AFib, I know you have something you're very excited about, and I'll let you talk about it. I was going to ask you about ventricular arrhythmia. I don't know if I have to do that before you unveil the...
So just briefly, ventricular arrhythmias are arrhythmias that arise from the bottom chambers of the heart. These are typically more serious, particularly if it's in the setting of patients who've had heart disease, like coronary artery disease, myocardial infarction, heart attacks. Those cause scarring in the bottom chambers of the heart, and those scars can cause ventricular arrhythmias or rapid rhythms from the bottom chambers that can be potentially life-threatening. So if you've had a heart attack, you really want to know what's your risk for ventricular arrhythmias, because these are potentially life-threatening. And these are situations where we sometimes recommend a defibrillator to be implanted in patients who are at a high risk, especially if the heart function overall is reduced. So that's one big area of what we do, as well as cardiac electrophysiologists. And you really want to see a specialist in those situations, because there are very many different ways of adjusting and programming and implanting these devices with the appropriate number of leads and the appropriate location for these leads. So that's kind of a very big component of what we do as well on a daily basis. But the atrial arrhythmias is where the atrial fibrillation problem is, and it's really from the top chambers of the heart. And as I was telling you, there are two big concerns with atrial fibrillation. One is really relieving symptoms. So patients are really symptomatic, especially the younger population that presents with atrial fibrillation does suffer quite a bit from atrial fibrillation. And that's exactly where we talk about what we call an ablation, which is a procedure to cure or to eliminate as much as possible of these of the areas in the upper chamber of the heart that cause the irregular rhythm. We've learned over the last 20 years or so that the disease itself moves on from being what we call a trigger-based disease, where there's these very special or focal areas that start firing away and causing all this havoc and chaos in the upper chambers, that typically come out from what we call the pulmonary veins. The pulmonary veins are the veins that drain the blood to the heart into the left upper chamber. And right at their entrance or antra are these foci or spots that are overactive. And in a sense, anything that causes distress to the left upper chamber can start causing atrial fibrillation down the road. So the ablation procedure that we do, which is a procedure that involves patients getting some anesthesia, us going through the femoral vein or the vein in the groin up all the way into the inside of the heart, involves us isolating or silencing or eliminating those areas of firings from those pulmonary veins. And that's where there's been a lot of evolution, a lot of technology that's been added so that we can do this in a very effective way and also in a very safe way for our patients.
Minimally invasive. And hold that thought. We're going to take a quick break. And on the other side, I'm going to ask Dr. Ahmed Osman about this new procedure that's available at Florida Medical Center for AFib treatment on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717 7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida. Welcome back. We're here with Dr. Ahmed Osman. He's a cardiac electrophysiologist with Florida Heart Rhythm Specialist, Florida Medical Center. His office is on staff at all the hospitals in Broward County, flahrs.com. Dr. Osman, before we broke, I was kind of teasing into this new procedure you have for atrial fibrillation. Tell us a little bit about it.
So for atrial fibrillation ablation, and I do certainly recommend that we address the atrial fibrillation interventions earlier rather than later. I see a lot of patients push it out and delay intervention, which really is not in their best interest or favor, because it does become a bigger problem with time. So we typically would love to see the patients within their first year of presentation, because that's where you're most effective with ablation intervention. And typically, or historically I should say, ablation had involved a catheter inserted from the groin up into the left upper chamber, and using a what we call radio frequency energy to ablate or cauterize or burn away the areas, the tissues that are active, and isolating the pulmonary vein. So the procedure is actually technically called pulmonary vein isolation, but with the way we have been doing it traditionally has been a point-by-point procedure, which we can do fairly well. However, it is a point-by-point procedure. It can be lengthy, it can be somewhat incomplete, it can be a little bit inconsistent, and we're not really delivering it in a very controlled fashion, in the sense that we're not visualizing where we are. We are using three-dimensional mapping systems, which are very accurate, but nevertheless there are some limitations to that technology. So then when we went on to look at other technologies that could help us do this in a more efficient and safe way, and one of them was a balloon-based intervention. So what I'm very, very excited about, and what I really wanted to share with you today, is this new laser technology, which does a very unique way of doing this. It allows us, first of all, to really visualize directly. So we have a fiber optic lens that allows me to see exactly where I'm delivering the energy. So I'm seeing the veins face on, and I'm very accurately delivering laser energy, which gives us, by the way, a very complete and thorough ablation energy source, and go around the pulmonary veins, which we want to typically isolate by making a circle around them, in a very, very accurate and controlled way. So it's really the best way, in my opinion, to deliver energy around the veins and to complete the isolation without leaving any gaps, because gaps can cause problems down the road. So that's a brand new technology that that FMC has been very wise to embrace, and I've been excited to do the first cases there and in Broward County, and we've had phenomenal results with our patients. The technology allows, again, a very controlled and a very effective way of hopefully helping all our patients. So that's been the new addition to the armamentarium.
And what is that called, Dr. Osman?
It's called CardioFocus or HeartLight.
HeartLight,
and
okay.
it's and it's a new basically it's a balloon based technology, because the balloon basically seals or occludes the vein. It gets inflated with heavy water, which is deuterium, and basically allows me to see the vein very directly, so direct visualization, as well as using the laser energy in a very, very controlled fashion. So
That's
I'm very
fascinating.
excited about it.
So it lights up the vein for you.
It does light it up. It shows me exactly where I need to go, and does not leave any room for guessing,
That's
which is really
great.
great.
I'm
So-
glad you brought that to our attention. It's cardio focused heart light, and you're doing the first one to do in Broward County and Florida Medical Center.
Yes.
That's fantastic.
And I really want to, thank FMC, because they really had the wisdom and the foresight to really embrace new technology and to really be able to offer this to their patients. So it's
And laser
very exciting.
guided, that's the latest in healthcare. That is great.
Absolutely. The clinical studies actually are showing much better results than what we previously had been seeing with other technologies that are available. There is another balloon-based technology, but there are some limitations, and I think we're really doing much better with that.
I want to kind of release the stigma too, because everyone knows I'm in the PR world. I have talked to a couple patients who've had, ablations in the past, and they told me that it's not a painful procedure. It's very minimally invasive. That's not it. It's just that if it's not gotten that first time, you may have to do it again. But now with the heart light cardio focus, the chances of the doctor having to do it again are pretty low.
They're clearly reduced compared to
Reduced
what
is the
we've
word.
had. I don't think we can say it's 100%, but I think we have clearly a much better chance and a shot at really doing what we want to do in the first place. So
It's the latest and greatest in cardiac electrophysiology. And you have another tool in your toolbox. You got all these new shiny tools in your toolbox.
plenty of toys. It keeps us excited. But yes, the second area that we worry about a lot in atrial fibrillation is strokes, as we mentioned earlier in the show. And we traditionally we've been using warfarin or Coumadin, which is a very old-fashioned drug that has been there for 50 years or so, with all its ups and downs and dietary restrictions. You tell your patient not to eat greens and so on and so forth. And it's a very difficult drug to manage.
Mhm.
But we also have had newer agents that we use that are much easier to take. The problem is, unfortunately, is that when you use anticoagulants, patients end up with bleeding problems. And a lot of our patients suffer from bleeding complications. And, that becomes quite problematic to many of them. And fortunately, we have alternatives now, and we have ways of excluding or occluding the main spot where those clots form in the left upper chamber. So we talked about the veins as being where the the atrial fibrillation comes from, but
Okay.
the left atrial appendage is really a little pouch that does gather and collect and is very stagnant as far as blood flow is concerned, and that's where these clots come from in the vast majority of patients. So if we are having problems with anticoagulants, such as bleeding in the gut, bleeding from soft tissues or skin, or bruising, or bleeding in God forbid, in the brain, because there is a risk of hemorrhagic stroke, hemorrhage in the brain. All of these patients have an alternative nowadays, and we're also very, very happy to be able to offer this at Florida Medical Center and in Broward County to our patients, and Broward General as well, where we can really exclude that left atrial appendage with this device. It's called Watchman.
Okay,
And
Watchman.
It's a device that basically deploys at the entrance of the appendage, and it seals it completely and excludes it from the rest of the heart, so that clots that form there would not be able to travel to the brain. It's a 30-minute procedure. We're talking about a very limited procedure that is a once in a lifetime, and basically you are relieved from having to be on a blood thinner or anticoagulant for the rest of your life.
Oh, that's great news, because I'd rather have a procedure than be on medicine, to be honest with you.
Absolutely, and patients really are relieved very much once they come off it. And there's a lot of reasons to really look at it. Patients who have bleeding in the urine, from the bladder, bleeding in the gut, and as people get older, there are more and more risk factors for bleeding, and we can see that very, very clearly. So it is a great alternative, and we're very happy to offer it as well.
That's great. You're doing so many great things at Florida Medical Center and Florida Heart Rhythm Specialists, your office. Again, we're here with Dr. Ahmed Osman. He is a cardiac electrophysiologist, or as he explained before, electrician of the heart. 954-678-9531 is their phone number. Great website, flahrs.com. There's a ton of information there. There's 4 cardiac electrophysiologists in his practice: Fort Lauderdale, Plantation, Margate, and Lauderdale Lakes, right on the campus of Florida Medical Center. They attend at all Broward County hospitals, That is amazing right there. We're so lucky to have your group right here in South Florida. Let me ask you one question kind of from a patient standpoint. So can someone just call you if they think, or do they need to be referred from a primary care?
You're most welcome to call directly if you need to be evaluated for a rhythm problem. But we get a lot of phone calls and referrals from all the internists in the county as well as the cardiologists in the county.
I know you come highly respected. A few of the doctors, PR people that I deal with on a regular basis said have him on. We have a minute, even though the music's playing. So I want to thank you again, Dr. Osman, for taking the time to come and tell us so much about the heart.
Thank you for inviting me. It's a pleasure anytime.
Yeah, we'll have to have you back on. So Dr. Osman does pacemakers, defibrillators, ablations with the HeartLite Watchman device, so much more. Check him out, flahrs.com. 954-678-9531. That's 954-678-9531. Dr. Ahmed Osman. Thanks for listening. Have a good evening.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those